Okay, let's dive right into this explainer. So for the longest time, healthcare has been, well, pretty reactive. I mean, think about it. It's kind of like waiting for your car's engine to literally catch fire before you finally decide to check the oil. That's essentially how we've treated the human body. But today, we're looking at a truly fascinating evolution that fixes this exact problem, the Rajiv Gupta Integrated Healthcare Model. It proposes a massive, fundamental shift away from just managing disease after the fact and introduces a proactive framework called health creation. Instead of treating isolated organs, a heart here, a liver there, this model looks at the whole person. It completely integrates modern clinical science with lifestyle, technology, and evidence-informed complementary therapies.
To really grasp why this is such a game changer, we have to contrast it with what we're used to. On one hand, you've got the reactive or acute care approach. This is basically waiting for a clear clinical diagnosis. You're waiting until an illness is firmly established, or worse, a medical emergency happens, before taking any real action. But on the flip side, we have anticipatory health creation. This right here is the beating heart of the Gupta model. It's all about continuously monitoring the body so we can catch those really subtle biological imbalances early on and correct them before they ever have a chance to escalate into chronic long-term deterioration.
So, how does this actually work? We're going to break this down into 4 key pillars today. 1. The integrated care journey. 2. Governance and patient safety. 3. AI and digital health. And 4. Measuring holistic outcomes.
Let's move to our first pillar and see how this all builds. Section 1. The integrated care journey, or navigating proactive health.
All right, imagine you're a patient entering this new system. Your care isn't random. It unfolds along a highly structured, super rigorous pathway. Step 1 is absolutely always conventional diagnosis and risk stratification. We're talking clinical labs, imaging, standard medical guidelines. Actually, let me emphasize that. Rigorous conventional medicine always remains the unshakable foundation here. Then step 2 is a whole person assessment. This is where they identify psychosocial stressors and modifiable lifestyle factors. Step 3 is building an individualized care plan with a whole multidisciplinary team. You're getting vital education on things like sleep hygiene, stress reduction, and self-management. And finally, step 4 is regular follow-up. The care plan isn't static. It's continually refined based on your clinical response and how well you're sticking to the new behaviors.
Now, during that whole person assessment we just talked about, establishing a comprehensive baseline is absolutely critical. The care team looks at objective cardiometabolic markers, things like blood pressure, BMI, and HbA1c, alongside respiratory and physical function, using tests like the 6-minute walk test or frailty assessments. But, and this is key, they also measure subjective psychological indicators. We're talking anxiety scales, pain scores, quality of life questionnaires. By mapping out both the physical and the psychological sides of the equation, the team and the patient can set realistic goals together. It genuinely empowers shared decision-making.
When a patient first enters the system, there's a very clear pathway for how decisions are made. If the issue is acute, say a broken bone or a sudden infection, they are routed immediately through conventional Western medicine, no questions asked. But if it's a chronic or systemic issue, the pathway totally opens up. Depending on the patient's specific persona and preferences, modern conventional medicine seamlessly merges with non-Western approaches, like Ayurveda or acupuncture, as well as lifestyle and mind-body interventions. It becomes this continuous, dynamic loop of assessment and personalized care.
Moving right along to our second pillar, Section 2, Governance and Patient Safety. This is the clinical safety net.
Naturally, combining different medical philosophies raises a pretty big question. How do you make sure the therapies don't conflict? Well, patient safety is the absolute cornerstone here. This integrated system operates within incredibly strict clinical governance frameworks. It's definitely not a free-for-all. We're talking about rigorous standard operating procedures, verified practitioner credentialing, and mandatory shared electronic health records, so every single provider sees the full picture. A massive priority here is herb-drug interaction assessments, which is just critical for patients on things like anticoagulants, immunosuppressants, or chemotherapy. This multidisciplinary safety net works silently in the background to protect you.
To put it bluntly, we really have to separate safe, integrated care from unregulated alternative medicine. They are not the same thing.
Safe integrated care is medically governed, it's evidence-informed, and it's bidirectional. That means modern medicine informs the safe use of complementary therapies and vice versa. On the other hand, unregulated alternative medicine is often fragmented and frankly dangerously tries to replace essential, life-saving medical treatments. Under the Gupta model, complementary therapies are strictly supportive adjuncts. They are never, ever replacements for essential medical care.
And to guarantee that safety, the model implements mandatory stop rules and escalation pathways. So, let's say a patient is undergoing complementary care for something like chronic joint pain, and suddenly their clinical parameters worsen or a red flag symptom pops up. Boom! The system halts the complementary treatment immediately. It instantly triggers a pathway that seamlessly refers the patient straight back for formal medical evaluation or acute hospital care. The bottom line? Complementary care never delays emergency specialist interventions.
Okay, let's jump into the third pillar, Section 3, AI and digital health, or as I like to call it, the superpower of anticipatory medicine. Imagine a healthcare system that doesn't just check on you during a rushed 15-minute annual visit, but instead continuously tracks your health profile while you sleep, work, and go about your day. That is the magic of anticipatory medicine. It's the use of continuous physiological monitoring and predictive analytics to spot the long-term precursors of chronic diseases way before they escalate into acute emergencies. Artificial intelligence fundamentally shifts our focus. We're no longer just reacting to established illnesses, we are proactively triggering health recovery.
So how exactly does AI pull this off? Well, it's constantly synthesizing continuous digital biometrics from wearable sensors. It's tracking things like your resting heart rate, arrhythmias, your sleep quality, daily physical activity, and even metabolic markers like waist circumference. By crunching this massive, continuous stream of data, the AI learns exactly what is physiologically normal for you on a daily basis.
And because it knows your personal normal, it can literally map the physiological blueprint of early disease transition. Think about it. The transition from healthy to sick isn't usually sudden. Months prior, the AI might detect subtly declining physical activity levels. Weeks prior, it catches sleep disturbances and poor sleep quality. Days prior, it registers elevated stress hormones and metabolic shifts. Today, before a formal diagnosis is even necessary, the AI flags these precursors, empowering community health navigators to intercept early with targeted lifestyle coaching. It's like having a crystal ball for your health.
This gets incredibly powerful when we bring epigenetics into the mix. Your DNA gives you your baseline genetic risks, but it is absolutely not your final destiny. Our genes are in a continuous interaction with our daily behaviors. So, by synthesizing your baseline genomic data with real-time physiological data from wearables, AI reveals your epigenetic potential. It allows the care team to deploy early, highly tailored lifestyle interventions that can actively alter your long-term disease trajectory. You're basically changing how your genes express themselves, which is just mind-blowing.
Now, what's really interesting about this final pillar, Section 4, measuring holistic outcomes, is how it redefines getting better. If we're totally changing how we practice medicine, it stands to reason we have to completely redefine what getting better actually means, right? The Gupta model uses a multidimensional outcome assessment. Now, it absolutely still measures traditional clinical outcomes. We're still looking at blood pressure, HbA1c, and inflammatory markers. But it equally weighs functional outcomes, like your independent mobility, your exercise capacity, and your ability to work. It also measures psychological outcomes, like anxiety, depression, and resilience. And crucially, it includes health economic evaluation, looking at healthcare utilization, like reductions in emergency room visits and hospital admissions. It literally measures the whole picture.
So the crucial point here is that holistic interventions produce highly specific, measurable biological outcomes. Let's look at yoga, for example. It actually rebalances the body's inflammatory system. We aren't just talking about feeling relaxed after a class. The model tracks concrete biological reductions in C-reactive protein and cortisol. These are objective biomarkers, proving that evidence-informed complementary therapies have a profound, measurable physiological impact on chronic disease pathways. Which brings us to a really powerful quote from the source material. The true success of integrated medicine lies not only in treating disease, but in improving health, function, quality of life, and long-term well-being. In this model, quality of life is never dismissed as some secondary, soft outcome. Not at all. It is a central clinical indicator, simply because your quality of life directly dictates your functional independence, your willingness to actually stick to your treatments, and your overall resilience.
So what does this all mean for us?
We've walked through the structured, integrated care journey, the incredibly rigorous safety governance, the absolute superpower of predictive AI, and the multidimensional ways we measure true success. The shift from reactive sickness care to proactive health creation isn't science fiction. It's entirely possible today. So I want to leave you with this question to chew on. Are you ready to actively influence your biological destiny through anticipatory medicine and evidence-informed integrated care? It's a whole new frontier for our health. Thanks for joining me on this explainer, and keep exploring.